Hi there. Have you ever thought about what those strange signs from your body could mean? Being able to spot possible problems is very important in a world where health is very important. Take diabetes as an example. It affects millions of people around the world. But do you know what to do if you or someone you know has diabetes? Your body may be trying to tell you something important by changing its blood sugar levels or making you feel tired all of a sudden. Here are the 7 most important diabetes emergency signs you need to know. Are you ready to learn more about your body's signals and uncover the secrets they hide? Let's jump right in. 7. Having low blood sugar or hypoglycemia. Hypoglycemia is a condition in which the amount of glucose in the blood is too low. It is a common worry for people with diabetes, especially those who use insulin or certain oral medications to control their condition. Blood sugar is the main source of energy for the body's cells, including those in the brain. If blood sugar drops too low, it can cause a number of symptoms, and if not treated, it can become a medical emergency. Low blood sugar can cause a number of symptoms, such as shakiness, sweating, rapid heartbeat, anxiety, confusion, irritability, dizziness, and hunger. The body is sending these symptoms as alerts that it needs help right away. People with diabetes can better control their blood sugar levels if they know how to handle hypoglycemia. 6. Having high blood sugar or hypoglycemia. Hypoglycemia, also called high blood sugar, is when the amount of glucose in the blood is too high. This can happen to people with diabetes. A lot of people worry about diabetes. Hypoglycemia in diabetes is mostly caused by a mismatch between glucose and insulin, a hormone that controls blood sugar. There are 2 main situations that can happen. This autoimmune condition leads to type 2 diabetes. The body doesn't make insulin, so glucose can't get into cells. This causes blood sugar levels to rise. Type 2 diabetes. In this type, the body either doesn't use insulin properly, insulin resistance, or doesn't make enough insulin to keep blood sugar levels normal. This disease is a clear sign that changes need to be made to how diabetes is managed. This could mean taking recommended drugs or changing insulin levels. Knowing the signs of hyperglycemia lets you act quickly, which could help you avoid diabetic emergencies that need rapid medical care. 5. Being in ketosis. Ketoacidity in diabetics is a serious, life-threatening complication that can happen to people with diabetes, mostly type 1 diabetes. It is marked by dangerously high levels of ketones in the bloodstream. DKA usually happens when the body doesn't have enough insulin to let glucose enter cells for energy. Treatment usually includes intravenous fluids to rehydrate the body and insulin to lower blood sugar and stop ketone production. Keeping an eye on blood sugar levels, taking insulin as directed, and spotting early warning signs can help stop diabetes, which is a medical emergency that can be life-threatening if not handled. 4. Low blood sugar. Hypoglycemia is a very important emergency sign in diabetes. It happens when blood sugar levels drop below 50 milliliters, 2.8 milliliters, which is very low and can be dangerous. It mostly happens to people with diabetes who take insulin or certain oral drugs to control their blood sugar levels. This drop in blood sugar can happen quickly and could be life-threatening if it isn't treated right away. Insulin is important for controlling blood sugar because it lets glucose enter cells to provide energy. If hypoglycemia is not handled, it can get worse and cause symptoms like loss of consciousness. This is why hypoglycemia is considered a medical emergency. Treating it quickly can help avoid problems like injuries from falls or accidents that can happen during episodes of loss of awareness or seizures. 3. Diabetic neuropathy. Diabetic neuropathy is a common and possibly dangerous complication of diabetes that can happen after a long time of having it. Nerves all over the body are damaged by high blood sugar. The nervous system is made up of 3 main types of nerves: sense, motor, and autonomic. All of these nerve types are affected by diabetic neuropathy, which can cause a wide range of symptoms and problems. If you don't treat diabetic neuropathy, It can lead to serious problems like amputations and serious stomach issues. Catching it early can help stop these life-changing consequences. Managing and treating diabetic neuropathy early can help lower the costs of hospital stays and complications. 2. Eye problems. Eye problems are an important part of managing diabetes, and people with diabetes need to know how to spot the signs of diabetic eye complications. Diabetes can damage the blood vessels in the retina, which is called diabetic retinopathy. It can also cause other eye problems, like glaucoma and cataracts. These issues can show signs of diabetes in a number of ways. One of the first signs of diabetes retinopathy is blurred vision, which can change over time. People with diabetes may only feel this for a short time, and to different degrees. These are caused by tiny blood vessels bursting in the retina, leaving dark or empty spots. A vision as diabetic retinopathy gets worse. Dark or empty spots can appear in the visual field. This is a warning sign that needs quick attention because keeping your eyesight healthy is important for daily life. Taking care of eye problems early on can help people with diabetes live a better quality of life by preserving their independence and well-being. 1. Problems with the heart. Many people are worried about diabetes because of the complicated link between it and heart health. Heart problems can happen because of diabetes, so this is an important part of the diabetes emergency signs list. You should know that people with diabetes are much more likely to develop heart disease. High blood sugar can hurt the nerves and blood vessels that affect the heart and blood vessels. This can cause atherosclerosis, which makes the arteries hard, which can cause heart attacks and strokes. You can live a healthier, happier life with diabetes if you stay aware and take action. This is it for today. We hope you enjoyed the video. If so, then share your thoughts in the comments and also share this video with your friends. Don't forget to subscribe to our channel and press the bell icon so you can never miss our video.